Now, just days ahead of Carnival, with millions of tourists expected, Brazil is on high alert amid a surge in cases of dengue fever. The cities of Rio de Janeiro and Sao Paulo have now both declared public health emergencies and have opened dedicated centres to treating people who may be infected. To tell us a little more, our science editor, Julia Seeger, is with me. And Julia, first of all, just on the numbers, they are really quite staggering. Brazil recorded 4 times as many dengue fever cases in the first weeks of this year compared to the same period last year.
Exactly. They recorded altogether 340,000 probable cases of dengue fever. So indeed, that's 4 times more than the same period last year. As you said, the government declared a state of emergency. The health ministry has also reported 31 confirmed deaths linked to the dengue fever, but also they're still investigating 234 others. Now, the stakes are high. The Carnival is set to begin in just a few days with lots of tourists who are expected. So several states have already deployed emergency measures. They're spreading larvicide in hard-to-reach areas to try to get rid of the mosquitoes that actually transmit the disease. So dengue fever is actually a virus that's transmitted through female mosquitoes of the family of Aedes. Indeed, there are several strains of the virus. So you have Dengue 1, Dengue 2, 3, and 4. And so what actually happens is when you contract one of those strains, then you're going to, of course, get the immunity for that exact strain, but not for all others. So you can actually contract dengue fever 4 times. And so we don't really understand how it works, but it's believed that it's because of those possible multiple infections that you're going to develop a severe case of dengue fever, because the majority of infected individuals indeed are only going to develop mild symptoms. So usually it starts 4 to 10 days after there's 4 to 10 days of incubation, and then there's a high fever, nausea, vomiting, headaches. But then after a few days, in general, 7 to 10 days, everything gets back to normal. But in 1% of cases, people develop severe cases. So hemorrhagic dengue, it's called. And this is when people develop different types of hemorrhages, let it be in the brain, in the intestinal region as well. And that is indeed a deadly version of dengue fever.
And Julia, what treatments are available?
Actually, there are no specific treatments for dengue fever today. We only use analgesics. The effort is really concentrated on prevention, so mainly having to do with combating mosquitoes, because they're the ones spreading the virus. There's also individual protection measures like eliminating stagnant water or using repellents. When it comes to insecticides, actually, it's now, because it's been so widely used recently, it's actually created a resistance phenomenon in mosquitoes, and now they're not as efficient as they used to be. There are 2 vaccines on the market today, but none of them are actually officially recommended by health authorities, at least here in France. The first one is Dengue from Sanofi, and it actually it was shown to be very dangerous in people who hadn't contracted the virus previously. And the second one is from a Japanese pharmaceutical company, Tadeka, but it doesn't work on all strains. Now, just a few days ago, there's a revived hope here, because following clinical trials in Brazil, once again, clinical trials showed that a vaccine, Butantan DV, it's a single-dose vaccine. It seems to be efficient, and it seems to not have any side effects. So we'll have to follow up on that.
All right, well, potential good news there. Thank you very much indeed for coming in to tell us a bit about that. Julia Seeger, our science editor, for us there.